Hello and welcome. I am Ashok Rajguru, your tutor, and now I shall present the case which relates to tic douloureux, which is the French word to describe trigeminal neuralgia. The graphic that you see here is a painting, an artwork of a Norwegian artist called Edvard Munch. And in fact, there are many versions of this created by the artist. He has made a lithograph, an oil painting, as well as a pastel work. And this has been put here because a patient resource group uses this particular painting as an image to symbolize the condition, which is one of the most painful conditions known to man. The objective of this video is very brief. It is to present the case as it was received by the author. The resource for this case is an article that was published in the book Testimony of the Clinic by the famous E.B. Nash. It was presented by Dr. Harvey Farrington, who was a very illustrious son of another great homeopath, Dr. Ernest Farrington. One of Dr. Harvey Farrington's book is Homeopathy and Homeopathic Prescribing. It's a very slim volume, but it's a very good book to study remedies because he had written this book. In fact, the book is a collection of the lectures which he delivered to allopathic MDs who were attending his medical school. So very good information in there, very well written, and it covers something like about 100 remedies, 100 remedies. So first we talk about the patient. He is one person who has been described as Mr. FMB, a male who was 50 years old when he came to the doctor. He had a history of this complaint for 30 years. A long period of time this poor chap had been suffering. And he told that in his family, his mother and brother had also suffered from the same condition. Now a description of the pain as described by the patient. He said that it starts from the root of his canine tooth, as shown by this lightning symbol in the graphic, on the upper left side, and it extends to the root of the nose. Once again, we can see that on the graphic. Then it moves towards the left eye, and at times it extends to the vertex of the head. It comes like a flash and goes as quickly as it came. This graphic shows the face from the right hand side, but the complaint is to the left side of the face. Please take a note of that when you start doing your repertorization of the case. Then the aggravations that have been reported are slightest motion of adjacent parts, talking, eating, or even touching the mustache. As a matter of fact, if there is a wind blowing, regardless of whether it is cold or warm, it can trigger that pain, which probably is because the mustache vibrates. So any kind of a movement, any kind of a touch triggers this painful condition. It's also there when he first moves in the morning. Continuing further, the ameliorations described are he's much better at night. Very seldom he has had that problem in the night. Better lying down. Slightly better by hard pressure. Occasionally, but not often, better by heat. Anytime he has that pain, the patient says that tears will roll down his cheeks. And after some paroxysms of this pain, the eyeball itches. Once again on the left side. He had been to a homeopath earlier, and the previous remedies, which had been given over a course of about 4 or 5 months, from the end of January till the middle of June in the year 1906, were Magphos, Sepia, Magcarb, and Spigelia. They had provided very little relief, and so he was forced to go back to the allopath. However, following another attack, he returned to the homeopath and came to Dr. Harvey Farrington. Allopathy had not helped, and the severe pain had disheartened him, and he was quite hopeless and in despair. He was on the verge of nervous prostration. And now there was no relief from either heat or pressure, which was the case when he had seen the homeopath previously. And he reported two new symptoms: itching of the affected parts before the pain and a tingling and itching afterwards, which means he's talking about the attack or the onset of those symptoms. So in summary, we saw that this particular person came to Dr. Harvey Farrington and he gave a description of the pain. He also told us about the extension or the radiation characteristics of the pain and gave a fairly good set of modalities. As we shall see in a later module, in the modalities, what is more important is aggravation as compared to the amelioration. And we'll also take account of the new symptoms when we do the analysis. So coming up next, we'll see how to choose the rubrics, how to use the X diagram, and how to proceed with the analysis. That will also tell you how not to do an analysis in order to achieve good results. So thank you very much for your attention, and see you in the next video, which deals with analysis. Bye bye.